Did you know there are many different kinds of procedures you can choose from when it comes to bringing back the youth to your face? Utah Facial Plastics Dr. Thompson is going to be performing 2 different facelift procedures today on the Younger You.
I'm on top of the world, now I'm living, and the good just gets better, keeps on giving. Not even close to the end, it's just beginning. Life is getting lighter while the days are getting brighter, yeah. And it's a good, I won't even worry anymore. Took all my cares, took and kicked them all out the door. Go on and try, come and tell me what you're waiting for. Move and keep them going till your life is overflowing, yeah.
Welcome to the Younger You. A facelift isn't a new procedure to most of us, but with there being so many types in today's market, we needed to break down in more detail with what we are going to be doing today. So we're going to discuss the difference between a full facelift and a mini facelift, also known in Dr. Thompson's office as a max facelift. Dr. Thompson, the double board certified facial plastic and reconstructive surgeon that will be performing our procedures today, is here to answer some of our questions. Welcome to the show, my friend.
Hi, Troy.
Okay, tell me the difference between a mini facelift and a full facelift. Now, we want to make it very clear. You call a mini facelift a max lift.
There are many categories and subcategories of facelifts.
Let's talk about that.
And, you know, you could get a different story depending on whose office you went to, and people do things very differently. In general, a mini facelift is something that is thought to be minimal incision, so a shorter scar on the face and less involved, less invasive. Typically, most legitimate facelifts, even a mini facelift, will involve at least some muscle work. So we're lifting the muscle, but it's just less extensive. It usually doesn't involve the neck quite as much, and especially someone that has a really heavy neck, a mini facelift usually won't really do too much for that.
So what's the purpose of doing a mini facelift as adverse to a full facelift?
A mini facelift or a minimal incision facelift, all of these different names that facelifts are known by, generally is just intended to treat someone that has more mild aging changes. So mini aging, mini facelift. So if you have some early jowling and you don't have a real heavy neck or heavy jowling or a lot of loose skin, those are good candidates for a less invasive mini type of procedure.
And the full facelift?
A full facelift is for someone that has either, sometimes they don't have really heavy jowls or a heavy neck, but they just have a really heavy face. And doing something minimal just won't really address the problem. So maybe when you look at their chin to their neck, there's no definition between the chin and the neckline. And those kind of people are better with something more involved.
Okay, this was an interesting viewer question. In your professional opinion, Dr. Thompson, how do you achieve the most long-lasting results with a facelift?
The long-lasting results of a facelift are determined by how much work is done underneath the skin. So if less work is done, in general, the result is going to last less amount of time. So for example, the MACSlift won't typically last as long as a full facelift. However, they get long-lasting results, but with a full facelift that I do, the entire mid-face and lower face and neck is separated from the underlying bone so that it can be moved up and repositioned.
Which is something that I've seen you do, and you've actually shown me how you move the muscle there as well. It's quite incredible.
It's pretty involved and it's fairly significant surgery.
So when you do a full facelift, does that include the neck?
Yes, it does.
But a mini one does not?
The mini facelift or the max facelift that I do does correct the neck, but it's just not. It's not someone that has a really heavy neck.
Okay.
But it's for people that have maybe some mild laxity of the neck.
I want to talk about the max facelift, which is what you really specialize in.
Right.
And you know, we're calling it mini because we know what we're saying, but at home we want everyone to know the real title for you. How is it done, and why does it differ from a normal facelift?
A max facelift is done completely under local anesthesia typically, so the patient's completely awake and we just numb the face with injections. So it's just done in an office setting. As I mentioned before, the incision is shorter, so it starts right here under the hairline and it just extends down to the earlobe. And it really is focused on this area, the jowl area, and minor neck improvement, as opposed to the facelift, which the incision extends all the way around the ear and into the hairline, and I go way under the skin and detach a lot more skin and soft tissue to really give a more I guess, dramatic lift
Yes.
than what happens with the MACSlift.
So for everyone sitting at home, when you say it does this part of the face, can I say that you're really adjusting from the nose up so people don't feel that you're then going to do the forehead as well?
Yeah, the forehead is a completely separate
That's what
category.
I want to break up.
It doesn't, the MACSlift and the full facelift, neither one of those address the forehead. The MACSlift really just addresses the lower jowl area and a little bit of the neck.
Gotcha.
The full facelift addresses the cheek, the jowl, and the neck completely. And as I said, it's really a lot better procedure for people that need a little more of a dramatic improvement.
Thank you, Dr. Thompson. Well, make sure you stick with us because we're going to go in a little bit more detail regarding the full facelift and Max Facelift. Plus, I get to answer some of your questions that you wrote in about. Stick with us.
Like us on Facebook for updates on the show and how to join the Younger You conversation.
More than 128,000 people had a facelift in America for 2014. However, that number is down from 2013. Dr. Thompson, I'm thinking to myself, is it because we no longer want to have facelifts, or are we just doing more work to begin with to put off the facelift? What do you think?
My guess is that it's more that there might be some people that have bad results. Sometimes we see celebrities that we think, oh, that facelift was overdone, or their face doesn't look good. Or there have also been, there's kind of been an explosion of people doing facelifts and mini facelifts. And I've seen a lot of patients with bad scars or surgery that just doesn't look natural. And I think that would sometimes turn people off from having this type of surgery. And so I think it's just really important that you educate yourself very carefully before pursuing anything like this, because there is really good surgery out there, and there's surgery that looks natural, there's surgery that makes a huge correction and doesn't look like you've had something done surgically. And so it's important to kind of sift through all of that and figure it out in the process. But I think you're right, there are more injectables for sure happening.
Yeah, preventative.
Yeah.
I'm all about preventative.
Yeah.
I'm a little bit scared to have the lift just yet, but I will. You know I will. I'm all about it. Are you ready for some of the viewer questions?
Definitely.
I love them. I think they're great. Dr. Thompson, I'm a guy in my mid-40s and might be considering having a facelift or some other type of rejuvenation. What would you suggest?
I like to sit down with a patient one-on-one and kind of determine what their specific concerns are. Not everybody is ready for surgery. Maybe they don't need surgery, or maybe that just seems like a lot. If you've never done anything before, sometimes I recommend just doing something a little smaller to start with. I love
that. Well, that's one thing you're known for, Dr. T, is not overdoing it. You're all about the consultation and education to begin with.
That's what it's all about.
Yeah, it's really important. Another one. I just turned 30 years old. What can I do to prevent or protect my face from aging prematurely? And you specialize in the skin on the face, so
yeah, this is where all of the little things come into play. The Botox, the fillers, the injectables. People say, oh, I don't want to do that, it doesn't last forever. Guess what? If you do it on even a once a year basis, it will dramatically slow down the progression of the lines that develop. And then skincare, you know, we talked about.
You and I always
huge.
talk about that.
Yeah.
And sunscreen.
Sunscreen is part of skincare.
Yeah, so. Okay, gotcha, because not everyone uses good skin cream, as you and I both know.
Right.
One more question. My husband and I are the same age, yet he looks younger than me. Is there a medical explanation? I just say good genes, darl.
Yeah,
good genes.
that's you know, unfortunate that that's sometimes the case, and probably the #1 factor there is genetics.
Yeah.
But then there is a big environmental factor as well.
Course.
If you spend a lot of time when you were a teenager in the sun, then you're more likely to age more quickly. If you're a smoker, you're going to age more quickly.
All right, thank you so much. I think they're really good answers. Thank you. Well, it's time to meet Julie, our patient who received a Max facelift. Let's take a look.
I'm Julie Fosmark. I'm going to get the Max facelift. I'm 54.
Now, the note said you wanted to do some injectables at this.
Yeah.
Okay, what did you want to do? Botox and filler?
Yeah, my mouth, and then I always have had this done, but I haven't for a long time. And
Okay, squint for me. Okay.
I had seen the program before, and I saw the MACSlift, And I just thought it was amazing, the less downtime and the difference it made. And I was just really intrigued with it.
Yeah, I think it'll tighten your neck up a little bit. Like I told you, it's not primarily intended for the neck, but you don't have a really loose neck, so I think we'll get a good improvement. But yeah, right here I think is where the focus of our improvements can be, kind of like this a little bit. So.
I was blessed with my mom's hereditary, and she had a lot of wrinkles and sagging early. And I always thought it was because she smoked, and I have never smoked in my life, and I probably have more wrinkles than she did at my age.
So as I mentioned before, a lot of times with surgery I'll do some injectables. Sometimes it's Botox or filler. This case is Botox. This will paralyze these scowl muscles that create those vertical 11 lines.
I've read all about the MACSlift, and I watched it on the Younger You last year and taped it and watched it over and over and over and thought, oh, I would do that.
So this is the lipo part, and it feels really weird, but probably won't hurt much at all.
I think it's wonderful that people my age, 54, 55, 60, can have these procedures, because we still feel young inside. We still feel like we're 30 and we're running around playing with our grandkids, and we can maybe just look the way we feel inside.
Swelling varies a little bit, but this is one where there typically isn't a lot of swelling. There will be some kind of over here on the sides where we were working.
I see the outcome for me with the MACSlift is just feeling a little bit more fresh, a little more rested, just a little bit overall younger.
Closed captioning for The Younger You is brought to you by Mindful Medical. Before the break, we watched as Dr. Thompson performed a Max facelift. Shelley, our next patient, had a full facelift among some other procedures that we'll chat about later in the show.
My name is Shelley Colrum, and I am here because of kind of a series of events that happened. End result, I'm looking to get a facial rejuvenation.
So today with Shelley, we were addressing several things that were kind of happening as she's gotten toward middle age.
Something that's bothered me have been, you know, this portion of my face here, and then around my eyes. And I thought, you know, it'd be neat to be able to go in and get my eyes done.
We're going to be working on your upper eyelids to take some of this excess loose skin here, the lower eyelids, and mainly for that I'm going to be, you know, just getting rid of some of that puffiness is primarily what we're doing, is kind of moving some of that fat down a little bit so that you don't have that hollow under your eye anymore.
When I first noticed in looking in the mirror that I wasn't getting the reflection that I'd had in years past, probably when you turn 50. I think when you turn 50, you start to see a change.
Working around the eyelids is a delicate operation. Certainly the eyes are obviously a very sensitive and important part of the body or organ, and so we have to be careful about nerves and blood vessels in that area. The skin is extremely thin, so we use very small stitches, and everything's done kind of on a smaller level than maybe other areas of the body.
And then the last couple of years, I've really noticed that, you know, the reflection, and in pictures, I wasn't big on having pictures taken because I just wasn't seeing the person that I felt like.
The upper eyelids are best approached through a small incision right in the crease of the eyelid, and it's right there, usually just a little extra skin that we're taking.
To feel like I look, and this is so cliche, but I know a lot of women say this, but to feel like I look on the outside the way I feel on the inside. Because I've been a runner all my life, and always, you know, try to take care of myself, my body, with what I eat and what I do, and to not have that same reflection, you know, in my body, it feels good, but to not see it in my face, it started to bother me.
The lower eyelids are a little bit more complicated because not only did we have a little bit of excess skin that we trimmed, but we also went after some of the fat compartment inside or underneath the skin.
When I first mentioned it to my husband, he was excited. He was excited for me. You know, the thought of possibly having it done, having some work done on my face. but he was also very sweet. He said, you know, honey, he said, you were beautiful when we were young and married, and he said, and you're beautiful at your age now, and kind of left that decision up to me. He said, if you feel like you want to get that done, I support you.
The lower eyelid is very vulnerable to downward pulling forces, and so we want to really try to leave that muscle layer as undisturbed as possible.
I think men just look at it different. They look at it more as they're getting more character. And I'm getting character too, but I still want to just look younger. And I want to look like I feel, because I feel good.
The lower eyelid incision has to be supported, the muscle has to be supported right to the orbital rim bone, otherwise it'll have a tendency to pull downward over time, and so we want to do everything we can to prevent that and to support the eyelid.
I have to say, with just as of late, when I've gone out and I've kind of been looking into this just over intensely the last few weeks, and I've been looking online and looking at ladies that have gone in and their before and after pictures. I mean, they look amazing, and you know, how can you not get that feeling of feeling good again?
So after we elevate the skin that's going to be redraped, I go and mark the deep muscle layer, the SMAS layer, and that's just marked according to what my plan is in terms of elevating the face. And so it has a couple of purposes. One is just to keep us in the anatomic area that we want. Since I'm under the skin, I can't exactly see that. And then the other purpose is just so I know where some of the nerves are of the face that I need to look out for, and it's mainly just to help me with the anatomy.
You know, as far as how people feel on the stigma with cosmetic surgery, I think it's evolving. I think it's going to change because, for one thing, we're living longer, and in living longer, you know, we're going to be older longer. It's changing, and I think hopefully the stigma will go down. I just think it's an individual thing. It's got to be something that you're willing to do, because it is a big decision. It is. So it's got to be, you know, just what you feel good with. It will be a process, but I'm excited to regain that feeling of feeling good and looking like I feel good.
After the break, everyone will be joining me on the couch and we'll get to see our patients' final results. It's my favourite part of the show, and it's time to see the before and after shots. Okay, girls, you look amazing. Julie, how do you feel?
Great.
Do
Great.
you?
Yes.
I remember when we were having the conversation in the hotel room when we had our pre-consultations, and you weren't there, Dr. Thompson, but you brought your girlfriend with you.
Uh-huh.
And she was supporting you.
Yes.
Has she supported you throughout this whole process?
Gosh, yes.
And
yes.
does she think that, because she said to me she wouldn't mind having something done.
Uh-huh.
How does she feel now?
There's so much out there that we're just constantly
Yes.
watching your show and looking at all the different procedures and what's out there. And
What can be done?
Yes, it's so much fun.
It's a never-ending minefield, isn't it?
It is.
How do you feel, my darling?
I feel great.
You look gorgeous.
It was the best thing I've ever done.
Really?
It was wonderful.
Dr. Thompson, we were talking off camera about self-confidence, and women and men have these procedures because they're feeling self-conscious. You actually had a good point about that.
These people are very self-confident. It's more that they're looking in the mirror and just saying, wow, this is not me. This is not how I feel. I never had this loose neck skin. I also always had a nice jawline. And so it's more about saying, well, that's not the me that I'm used to looking at, and I want to try to get back to that person, at least to some extent.
Is that how you felt?
Yes, yeah, I did. And then we talked about in the pre-interview before I had it done that my brother had mentioned I looked like my mom did in her 70s, and I was like, oh no.
And I think I remember saying, is he going to write a check for you to have all this done?
Exactly. And his answer was no.
And what does he think now? He was the one, he didn't suggest have something
No,
done.
he just
but
said
he was
I
implying,
had my mom's skin and that I looked a lot older than I am.
And how did you feel about that?
He's just being honest. And when he said that, I just thought, oh. And then I saw the segment last year on the MACSlift, and it wasn't the go under the knife, out and that. And so I saw it and I thought, well, why not?
Why not try it? Dr. Thompson, I just want to say while the two ladies are here with us, why did you choose a max facelift and then a full facelift? What's the difference for you?
For Julie, really her main issue was just she was starting to kind of get some loose extra jowling skin around the mouth and along the jawline a little bit. The neck was pretty clean for the most part, and so I felt that those were the main things that we needed to address. And of course, everyone's interested in doing the least invasive procedure possible. And so I thought the Max facelift would be a great fit for Julie. And for Shelley, she had
a lot done.
Well, she had more. She wasn't someone that I looked at and said, "Whoa, you look like you're in your 70s." Not at all.
Yeah.
She just had some issues, for example, under her eyes, where it was looking really hollow and making her look tired. That would be very difficult to address with just a MACSlift.
Did you do upper and lower
We
eye
did a
work?
little bit of upper, a little bit of lower, and face. And so when I lift the whole mid-face area and lower face, it's much more achievable to get a great result of the lower eyelids. And we can see that when we look at her photos. This is where she really looked tired. And so lifting up the cheek and the lower face helped to support that lower eyelid.
All right, girls. I want to ask you both, what else would you have done?
I'd have my love handles sucked out.
Oh, you'd have liposuction.
Yeah.
Would you? But you know you're going to have it sucked out of there and popped up here.
Well, why didn't you tell me sooner?
Well, we could do that. What about you?
You know, I don't know that I do anything. I mean, I'm pretty content with what I've had done.
Well, you've got a great little figure, my friend.
Well, thank you.
You do look good.
You.
You've got well-toned arms, and now you say you're in your 50s. I think you look amazing.
Good, thank you. That's the result I was looking for.
I love the fact that you can have these things done safely, professionally, and that you are educated whilst you are having it done as well, and that you do the research for you. I think that is the most important thing. And women your age are sitting at home watching you thinking, if they can do it, I can do it. You know, and this is why when we bring you in here and you have all your interviews, that we ask you questions about your private life and why you're wanting to do it. Are you feeling insecure? Because they're questions that people want to know at home. So thank you so much. We truly appreciate it. I think you both look stunning. And Dr. Thompson, again, incredible work.
Thank you.
You know we think you're incredible.
My pleasure.
Well, today we met two beautiful ladies who had facelifts for their own personal reasons. If you feel that you could use a little freshening up, perhaps one of these procedures is for you. But remember, beauty does start from within. For more information about the show or Dr. Thompson at Utah Facial Plastics, visit our website at theyoungeryou.tv, and I'll see you next week. Coming up next week on The Younger You, we'll get to see how pregnancy can affect venous disease and watch as Dr. Nasbitt helps remove Shannon's varicose veins. All right, let's clear it up. What are varicose veins to begin with?
The Younger You set provided by Madison McCord Interiors.